Has anybody else got a case of exercise induced cramping that they have brought to discuss as well? Because I am happy if there's more than one case. So just wait for a minute, see if anybody types anything in the question box in the affirmative. And I'm not seeing anything. Karen, are you seeing anything?
No, nothing here.
Lovely. All right, I'll keep moving. Okay, so the background to this webinar is that I had a case myself of exercise-induced cramping with one of the AFL Colts teams that I work for in WA, and it was really quite difficult to manage, which led me to think, gosh, there's probably many other people that are involved with sporting teams around the country that this becomes a problem for. Cramping, as you know, is a sudden severe involuntary muscle contraction, so an over-shortening, and it's considered an alteration to muscle relaxation. Historically, we know that its increased prevalence is seen in endurance athletes, and obviously there's also an increased incidence with increasing intensity or duration of activity. The earliest reports on this come from over 100 years ago, where initially people saw cramping and profuse sweating with workers in mines and steamships, and that was how the initial theories around cramping started, with electrolyte depletion and dehydration theories. This comes all the way through now to obviously today, where there's a alternative theory which was put forward in about 1996, where we have altered neuromuscular control being the underlying cause of exercise-induced cramping. But those two mechanisms are obviously to date still discussed with some ferocious debate, I guess. So we're going to start with a story. Essentially, I'm going to talk about a 16-year-old boy who was a state-level footballer who was otherwise completely well. He wasn't carrying any injuries, and he wasn't cramping at training. He was 4 or 5 weeks into a normal football season when he arrived with us for state training, and he'd done a full pre-season without any problems, wasn't cramping at training, but was having occasional mild cramping at club level games. We, as soon as he became involved with playing state practice games, noticed that he was having severe cramping really quite early on into the second half or the third quarter of the games. And at that point, I didn't know much more about this boy who was new to this age group, and therefore new to me, apart from that there was a high expectation to perform related to his sort of family history. So I will move to the next slide if I can. Thanks, Karen. So really, all I knew apart from that was what I then learned at the first practice game, where I came across him because he'd had an episode of feeling faint. It was quite a hot day, and he came off saying he felt faint. At that point, I met his father, who's a relatively high-level football coach in WA, who told me a lot about how he didn't think it could be related to dehydration. And I also found out that he'd had a close friend who was, again, a relatively well-known person in the football community pass away the previous day. He recovered very quickly from that, and we didn't have any other problems that day. Apart from that, nothing else to note, apart from Mum and Dad very involved with his football, and he was studying at private Catholic secondary school, but nothing to report really. So things moved on, and that game he came off early, and then the subsequent game the cramping became an issue. And obviously at that initial game, you know, he was coming off complaining of severe cramping, and we were treating him with, as you'd expect, stretching, both active and passive, and making sure that he had his usual fluid intake, and also Gatorade. So what happens is we get Gatorade and we get water, and we get them to take one water to one Gatorade essentially when they're drinking. After the game, I asked him about what he'd been doing as part of his usual preparation to see where we were from just a fitness level point of view. He'd been having regular hydration and was very, very conscientious about drinking during the day on school days before training, and making sure that his fluid intake was good, and his urinary specific gravity test pre and post practice games and training had all been not demonstrated any sort of significant dehydration. He also reported that he was taking salt tablets that were recommended by his father for cramping, and I never actually cited his salt tablets, although the use of salt tablets, it transpired as part of my investigations, but it was quite common in that age group's team, and there's sodium chloride 500 milligram tablets, of which they seem to take between 1 and 3, depending on how the mood takes them. He also was taking a magnesium powder, which he was taking daily, but again, I never actually got to see the preparation, so I'm not sure whether it was magnesium alone. And obviously that opens a whole other can of worms about checking your substances and checking whether the supplements he's taking were likely to prove problems with drug screening and things like that, but we'll leave that for another day. He was training with his club and with the state team, and he was keeping up with everybody as you would expect, and he certainly wasn't reporting any problems in training at all. He was also doing some extra training because he attended training sessions at the club where his dad coached, so that he was probably getting extra load compared to the rest of his peers, I guess. Okay, so the next slide, Karen, if we could, thank you. So we'll go on now to really looking at the in-game sort of description of events. So he'd usually play out the first half without any complaints at all. He's one of the better players in the team, plays on the ball, and his GPS was showing that he was covering very high distances, which we hadn't got a comparison to with his club level distances, but my suspicion was that it would have been far greater. He would come off in the third quarter complaining of cramping, usually both calves, and he struggled to get good relief, even for short periods with stretching, walking, fluids. The massage by the physio seemed to help return him to play for periods, but again, he'd come off 5-10 minutes later with significant discomfort again. He recovered very quickly post game. So at that point, he came off and settled almost immediately. So what I'm going to do now is I'm just going to stop at this point and open for any questions or comments from the floor, either with the hands up system or with the question boxes. Okay, so Karen, can I leave you in charge of that part? Okay, so any questions? No. Okay, keep going then. So
no questions at this point, Jill.
Okay, thank you. Okay, so what next? So look, from this point, obviously, I was starting to think, well, we've got to do something more for this boy. We're only at practice games, and we've got state competition coming up. Where do we go from here? So if we move to the next slide. As I mentioned at the start, there's two sort of schools of thought related to exercise-associated muscle cramping. The more historical theory relating to electrolyte imbalance and dehydration. And what that has been ultimately suggested is that the change in extracellular fluid and interstitial fluid related to these imbalances causes abnormal distension of the nerves, and that causes abnormal firing. Things that go against this are obviously that when you actually take samples of athletes, particularly endurance runners who seem to particularly suffer from this phenomena, what happens is that they actually have similar electrolytes and similar hydration to their peers that don't have the muscle cramps. So ultimately this then came to the point where people said, well, okay, what about altering the theory and looking at altered neuromuscular control? And how that comes is that obviously it appears that fatigue, and muscle fatigue particularly, is a big player in cramping. People tend to cramp late in marathons, late in triathlons, later in games, not from the start. And that makes us think that muscle fatigue obviously is a predisposing factor to exercise-induced muscle cramps. Now, there's several other factors that have been talked about in the literature regarding predisposition. The most obvious is that previous exercise-associated muscle cramping predicts future increased risk. There has been some controversy over whether family history is relevant or not, and the studies don't necessarily confirm or refute that. And there's also been evidence that it's more common in men. And they think that this might be because the skeletal muscles of men possess a greater proportion of fast twitch type 2 muscle fibers, which are known to be more fatigable. There's limited evidence to indicate there's a relationship between older age and muscle cramping, which obviously in my case today wasn't something that I was thinking was relevant. And again, they have looked at issues with body size, which shows no significant difference in BMI or body weight between athletes who cramp. There has, however, been a consistent association with prolonged activity performed at vigorous intensities, and that, I guess, in my mind was very, very relevant, because I was aware that this guy was playing on the ball and he was covering high kilometers, particularly for his age in the competition and training games. And it has been shown in advanced level rugby that the higher level you play, that also seems to be a predictor for exercise-associated muscle cramping. So the question, I guess, in my mind was, where do we go from now? And I had previously done some work with some of the AFL clubs, and have at that level known that pickle juice is used an awful lot in crampers. Okay, so can I maybe have a show of hands in the box for people that have heard of pickle juice being used in this situation? Has anybody heard of pickle juice being used in exercise-induced muscle cramping?
Yes, we've got a few that say that they've used it. Yes.
My club team never not heard of that before. Okay, good. I just note there's also a question there. Sorry, my question box is very small, which means that I only get to see one at a time. So if I don't look down at the right time, I miss it. So I will come back to that. We'll just talk about the pickle juice, and then I will come back to you, lactic acid. Okay. Okay. So pickle juice is essentially a salty, acidic juice. Okay, it's pretty revolting, as you all know, although if you're like me, I think pickled onions and pickles are quite delicious. Whether I drink the juice is another question. And what's been shown is that pickle juice essentially acts on what we think are transient receptor potential channels, which are found in the oropharynx, the esophagus, and the stomach. And basically, it's been shown that potent TRP channel stimulation has the potential to decrease the efferent neuronal function, including that of alpha motor neurons innervating the skeletal muscle. And why that's relevant is that if you are looking at the altered neuromuscular control theory, this plays out that what the description is that there's hyperexcitability of the alpha motor neuron, and there's a downregulation of the inhibitory Golgi tendon, organ, which sort of prevents that overexcitability. So it makes sense that if you can essentially downregulate this alpha motor neuron innervation of skeletal muscle by using some kind of strong excitatory stimulant, that hopefully you can attenuate the cramps. The research has been done using capsaicin, and basically, if you look at the studies, what they do is they use either capsicum, cinnamon, ginger, or a mixture, and they make people swirl it around in their mouth and then swallow it. But essentially, anything that's noxious but not harmful is thought to have a similar effect, which is how the pickle juice use of pickle juice started, because pickle juice obviously is nice and easily accessible and it's cheap. So we said to this guy, okay, look, let's try and get the pickle juice out when you start to cramp, swill it around in your mouth. If you can bear to swallow it, it doesn't make you feel unwell, do. If not, swill it around for 30 to 60 seconds and then spit it out. Anyway, by this point in the season, this chap was game for anything because he was feeling pretty fed up. So he came off with cramping in the third quarter. We gave him the pickle juice, and he did indeed report that he felt like it gave him some added temporary relief. But what it didn't do is reduce the number of cramping episodes in the game. So what we found was that if we did everything we were already doing with regards to walking, hydration, active and passive stretching, massage, and we added in some pickle juice, we could probably get him back on quicker, but it didn't necessarily reduce the number of cramps that he had in a game. It just meant that we could, manage him back on the ground, eat more easily. Okay, so now I just go back to this question. So what is the place of lactic acid in the causation of cramps? Okay, so the theory is, and as I say, this is all very open to debate, that evidence seems to sway away from lactic acid being the cause of the cramps, and that it's actually due to the hyperexcitability of the nerve supply to the muscle, the alpha motor neuron. I have got several papers which I can give you more information on, so I won't go into that in detail now, but there's references at the end, and I'm happy to supply further information if you'd like. Okay. Okay, so we've gone from pickle juice. The coach is starting to ask questions. What's going on with this boy? Are you sure it's not in his head? Why can't you manage it? He's fit, he's active, he's playing well in club games. Why is it when he comes to us and he's a problem? Okay, so I'm going to stop again and just see if anybody has any thoughts or comments at this point, because there's one very obvious comment that I will make if nobody else does. So, Karen, can I go to thoughts and comments with you and hands up?
Certainly. I have a comment from Gavin White, who says, I have seen some people run it with running related cramps in one calf. Ultrasound can show a small insertional medial gastric tear or old scar.
Yep, no, that's great. I agree, Gavin, that is something that should be excluded if you're struggling I think that's a very good point. Thank you. Anybody else got anything they want to add?
I don't have any hands up.
Okay. So you see, my thought at this point was, you know, the coach is moaning, but he's probably running 16 kilometers a game, and he's 16. And you know, I was very concerned that, you know, a lot of what we were seeing was related to load. So there was a great debate about load management, and the coach was somewhat unkeen, as you can imagine, to reduce his load, because he's very, very good. Now, he's only very, very good for the first half, unfortunately, at this point, but that didn't seem to, at that point, you know, be taken on board. So we continue. So we looked at other options, and we had chat with the player after the game, and essentially the options that we could suggest that were easy to access, or that we had used in the past between myself and some of the physios and the other club doctors, were kinesio tape. Now, kinesio tape is quite interesting in that what they think it does is reduces the vibration as the foot hits the ground. So the theory with the kinesio tape is that it sort of dampens down that muscle neuromuscular excitability. And as I say, again, I do have information for you that I can send out on this, but I'm not going to dwell on the mechanism of each thing. But essentially, kinesio tape has been thought that it might be worth a try, and it attenuates soft tissue vibrations on ground impact. And they think that improves your muscle activation, which then offsets your fatigue. Unfortunately, even though I quite liked the idea of that because I thought it was simple and easy to do, the player was unkeen because he doesn't like wearing tape to play. Okay, so the physiotherapists and sports scientists and I talked, and we thought, okay, we're already doing stretching, which definitely helps when we do it, but obviously it doesn't prevent the next cramp. Can we start some neuromuscular feedback and retraining? So is there a way we can actually try and train his body to reduce the overexcitability of the calf muscles, I guess? And it was Dean from the sports scientist that is in charge of the program, that he thought that at this point in the season it was probably too late to start that process, and that would be something they'd look at between seasons. So at that point, we then went back to the thought of quinine, which historically, as everybody will be familiar with, has been used in cramps for nighttime, and anecdotally has been used, in my experience, quite widely for athletes that are cramping where we're struggling to manage them. The problem with quinine, as you're all familiar with, is that it's was withdrawn for use for nighttime cramps because of the thrombocytopenia risk. And my other concern was that it is can be a risk for cardiac arrhythmias. So it was something that we didn't take lightly, but at this point we did think, okay, well, let's think about quinine. And quinine's interesting because nobody really understands the mechanism of action of quinine. But what we have been told in literature is that it seems to decrease the ability of the muscle to respond to and hold a tetanus, and that the excitability of the motor end plate is lowered so that the response to nerve stimulation is reduced. So those things make you think it's worth a try, assuming that we're going to do no harm. Okay, so can we go to the next slide, please? So with that in mind, we sent him for some blood tests, and my plan had been send him for some blood tests and see him in rooms with the family and actually have a relatively good discussion around, was there anything else going on from a psychological point of view? Was there anything else that I didn't know about that might be interfering with, with his play at the state level? And also a talk about quinine, given that it's not something that should be used lightly. That wasn't as easy as I thought, because I only ever managed to get to see this player either at training or games for short periods alone. His contact number with regards to discussion or contacting him was always given as his father's mobile number, and it was hard to speak to the player on his own outside. And unfortunately, the family felt that the follow-up in the rooms was unnecessary. The other thing that came out at this point was that whilst having some sort of soft tissue treatment with the physio, he had told her that he'd sooner play basketball. So there were some complicated dynamics, I felt, from a point of view, because he's a very, very, very good footballer, but I don't know whether he actually wants to be. And there was definitely lots of pressure from home. So anyway, the blood tests all came back normal. If we can go to the investigation slide, that would be great. His urea was 8.7, which is a little bit dry, which was interesting because we'd not picked that up in his urine-specific gravities. And everything else was normal, with particularly a normal full blood count. And his ECG showed a sinus bradycardia. We didn't do a blood sugar because he had had a random blood sugar done previously, which was normal. And essentially, with a normal ECG, with a normal QT, and with normal full blood count, it was decided that we would proceed with offering him 200 to 300 milligrams of quinine on the night before games. So not a regular dose. The plan was just that he took it the night before the game, and we saw how we went. And my feeling was that, you know, that's been commonly used in football before, and that obviously a intermittent use was probably safer in my mind. So we tried the first dose at the training session before the next game, because we didn't want him to feel unwell and actually be a problem from a side effects point of view. And he didn't notice he'd taken it, and that was perfect. That was what I wanted. So we ended up giving him 300 milligrams the night before the game, and at the next game he did significantly improve, in that the intensity and the frequency of the cramps was reduced. So he wasn't 100%, but he was definitely better. And the coach was definitely also feeling much better about things. The other thing that happened around that time, though, which complicates the issue, is that with the manager involved, we had managed to reduce his playing time on the ball, so that we were putting him up in the second half into the forward pocket for periods to try and rest him a little bit. So that was really, really good. So basically we managed to settle him through the rest of the state season. We changed our rehydration so that it wasn't funded for in the system, but we basically changed him to Gastrolite icy poles that were instead of Gator-Aid for his rehydration. He had a haircut, which I think actually was probably the factor that improved things, because it was the day he had a haircut, his cramping improved. So I really can't explain that, but it was very interesting. And we gave him lots of reassurance that we would get him through the season tournament and we would help him. And he played very, very well, and actually got the best player for the state in the tournament. So from the point of view of his individual management, we did manage to get him through, and it didn't in the end impair his game particularly. Now, as you can see, how we did it was by many different mechanisms, and things were still not 100%. And really the reason I thought we would have this webinar is because I was hoping that from the floor people could, you know, feedback on their experiences with regards to this, and also what they have found has been useful and has worked for them. So I might again stop at this point and just see if there's any feedback that comes from the floor again. So Karen, can you?
Andrew Ryan has said that in his older population, he suggests they use tonic water and they get improved sleep as less nocturnal cramps, but he's not sure about the dose in Indian tonic water.
Oh, look, well, you know what? It's definitely worth trying. Certainly, I think that's a good point. Like, we didn't think to try that first, but yeah, I will next time. Yes, I think that's very reasonable. Yeah.
And this is just a question, and not so much about the quinine, but Dr. Zakia has said that the incidence of cramps is less in a trained athlete than in an untrained one with the same amount of exertion. Is that
It
how can
is.
that be explained?
It is. And there's lots of information on the fact that when they look at lots of the research, that a lot of it is done in pre-season athletes who haven't got such well, can't think what the word is, who aren't so trained yet, who aren't so well trained. Essentially, that I guess feeds in my mind the likelihood that the altered neuromuscular control theory is more likely to be something that I would argue in favor of rather than against. Despite that, though, there is a subgroup of people, and we see this in studies from ultra marathon runners and marathon runners, and again in rugby, that they tend to come, these people that despite being the same training, the same hydration levels, they do get exercise associated muscle cramps, and we just really can't explain it. But we do know that if they're less trained and they are then doing high exertion, high lows, then they probably are more likely to get cramps. Yeah.
And just a question from Andrew Duthie back to the pickle juice. Could the pickle juice working be explained by the high salt content and support theory 1?
Yeah, not according to Craig Head et al., who basically did the research relating to the ingestion of transient receptor potential channel agonists. And what happened was that they did measure in some of the studies before and afterwards the concentrations of the electrolytes, and they didn't find a change in them.
And another one.
So that's sort of the suggestion, is that you can't explain it that way because it isn't enough. Yeah.
And just a comment from Gavin White, he thinks that the use of quinine in these situations is very reasonable given informed consent. I have had 3 teenagers respond really well with 1 dose for game day.
Yeah, and I agree, and I think I referred to a very senior learned colleague who's got lots of experience in this field, and it was him that suggested the dose and the night before as the one-off, and I think it worked really well. I don't know whether it was the only thing, but I think that given that circumstance, I agree with Gavin that as long as everybody's on the same page and everybody knows and you've done your workup, that it's not an unreasonable thing to do. So going back to the pickle juice, I have got an article that I can I think it might have referenced at the end, but if not, I can send the article out, Karen, as well, which that just goes through that as well.
I'll keep a list of what people are after.
Lovely, thank you. Okay, interestingly, with the quinine, just going back to quinine, the other thing that I did look at to see if there were any Cochrane reviews, and there's been a Cochrane review with regards to quinine in any age group, all cramp types. So it's not specific to our exercise induced cramping population, but it doesn't exclude them. And there was a comment in that they think that a quinine with theophylline together can be better than quinine alone for muscle cramps. Now, I have not heard of that before, and I haven't heard of anyone use it. And I was actually interested to see if anybody had heard of that or used it from the group. So maybe we could just see if anybody can put their hand up to having had experience at that, because obviously that seemed quite extreme in my mind.
Just another thing from Andrew Ryan. In a country A grade team, I look after 2 brothers who were cramping in the 4th quarter in their calves. We tried everything and found out it was related to tight glutes, increased lordotic lumbar spine posture, anterior tilted pelvis, tight hams and calves. We treated their glutes and lower blacks at half time, and the 4th quarter cramp stopped.
totally agree that there's quite good evidence, and that's one thing you should look at is glute strength. Yeah, if your glute strength isn't good, then you seem to be predisposed to lower limb cramps. Yeah. Okay, shall I keep going? Anything else before I do?
That's all the questions so far.
Okay, lovely.
Oh, shit.
Oh, I'm unmuted. Other factors. So look, I guess from a cramping point of view, I think we managed him as best we could for that season. I think that there's some other factors that I'm concerned about, and I suspect I probably will have him again next year. So in my mind, there are some things that we need to still explore further. There was no doubt that he put significant pressure on himself, and there was significant pressure from the family. There was definitely a perceived pressure from his teammates, although I don't think that they actually felt like that at all. I think they thought that he was running 3 to 5 kilometres more than the rest of them per game, and that probably he was doing more than his fair share. The coaching staff was interesting because it was a very seasoned coach who'd been around for many years, and Dad had also been coached by this coach. So his understanding of cramping in this situation was definitely a dehydration, electrolytes, this is not right, this must be fixed mindset. And some of our probably more useful education was actually trying to educate him into the fact that it's not 100% clear, but there's other things that we should try, not just give him more fluids, massage him, give him more fluids. As one of you has just alluded to, poor neuromuscular adaptation and poor biomechanics definitely can play a role in cramping as well. And in the off season, there's been a push essentially to regular muscle stretching, post-isometric relaxation techniques, correcting any muscle imbalance, posture, adequate conditioning for activity, looking at sort of plyometric exercises as well. So he's sort of gone to now the physio who's nurturing him through to try and improve his mechanics and his neuromuscular adaptation for the next season.
Just a question, Dr. Cowan, from Andrew Duthie, which relates to your next slide, I think. Do you expect him to grow out of this as he matures, or do these kids end up with the same issues in adult lives? I.e., will he need quinine every night before his AFL career?
Yeah, I think he probably will. I think we potentially will optimize him by doing the neuromuscular and motor control and mechanical side of things, but I think that there are crampers and there are not crampers, and I think he ultimately is going to be one of those people that is probably going to need something like that long term. Yeah. Does anyone have any comments on that? Because I'm happy for people to disagree. I'm by no means an expert on cramping. It was just that I thought that it's an interesting topic and we should talk about it. Any comments? No?
Not as yet, no.
Okay, lovely. So I think we've already touched on this, but essentially for the next season, looking at plyometric exercises, I would like to see him pre-season, and I'm very keen to review exactly what he's taking over the counter. Because the other thing in the back of my mind, of course, is that is something that he's taking that we haven't actually seen a provocative drug. And I don't know, because I'm not quite sure what he's taking from a supplement point of view. The other thing, of course, as I said at the start, was that if he is, if as he does progress through his career, that he will be drugs tested and he will need to know what is in what he's being provided by his dad with regards to sort of supplement type management. And obviously, I think that we need to optimize his psychological well-being. And I think that, as a general rule, there is a lot of pressure on these cults, and we should be aware of that. Okay, so that's the end of my formal sort of case presentation. I want to just again see what comments there are from the floor, and then I just was going to go through some of the evidence of what people have tried and what allegedly is meant to work, although some of it again is very fluffy, as most things in sports medicine are. There's not good studies and the numbers are small. So anything to add before I go on?
This is from Gavin White. Is it worth checking the CK on your test for cramping blood test? Picked up one McArdles through this.
Okay. In an ideal world, yes. But my trouble with doing a CK on any of these is that they're always going to have potentially raised CK because they train Monday at club, Tuesday at state, Wednesday at club, Thursday at state, Friday at club, and then play at least once at the weekend. So yes, but with him, we should do it out of season, and I haven't done it, and it's potentially a good thing we should do, yes. But at that time, I didn't because I was concerned we were going to get a raised CK and it was going to not help us. Maybe Gavin, would you like to further comment on that? Any way around that you can see?
No, he says.
No. All right. Thanks. Very helpful.
A question from John Gale, who is in sunny Mildura. You've presented a case of cramping in ballistic ball sports. What of endurance sports person and cycling and running? What are their cramp risks?
So there's actually more research and evidence in that population than there is in the footballers and rugby players and hockey players, and from my sort of reading around the subject. So in a lot of the studies, they've used marathon runners or triathletes. Essentially, what they found in these studies that the cramp group have serum electrolyte concentrations not significantly different from those in the control or non-cramping group. And that they didn't think there was changes in observed serum electrolytes as cramping subsided. They basically think that, again, it's about high load and long distance. So the particular reason that these guys are the guys they do look at in studies is because obviously they're doing significant kilometers at relatively quick speeds. There's lots to say on them. I don't know how much detail you sort of want me to go into, but certainly in the athletic events such as ultramarathon, the most common complaint in that population is cramping, and in some of the studies, they report 2/3 of complainants reported endurance-related cramping in competitions. In a 12-year summary of marathon runners, there was I think it was a 6.1% report. So 6.1% of reported medical encounters were for exercise-associated muscle cramps. So it's a significant number of people that get them. If we go back to the risk, as I say, if you've had it before, you're more likely to get it again. That some people report that they think there's a family history. So I think that they found in triathletes that if there was a family history, then they were more likely to cramp than non-cramp prone triathletes who were less likely to have a family history. But again, the evidence is a little bit open. The gender-related stuff, that the research relating to the suggestion that it's more likely in males because they've got a high percentage of type 2 fibers, and that research was done in ultramarathon runners. So lots of these studies are from more of the studies are from ultramarathon triathletes and marathons. Yeah.
And
Does
just
that
a
answer that question?
a comment from Mark Rafe, which he has said
Yeah.
that he's had some luck with hypnosis, which he's been practicing for over 10 years. He said there's no evidence, but may increase pain inhibition.
Yeah. Okay. No, I haven't seen that, but that's very interesting. Yes. Does he know of anybody else that does that, or is that something that we could access in other states? Because Mark's in South Australia.
Mark, sorry, do you want to speak, Mark?
Oh yeah, well, if you unmuted me.
Hi Mark, how are you?
Very good, Jill. Great. Sorry I came in late. I haven't heard of too many other people doing sports hypnosis, but in particularly in AFL players, like you're talking about, with a high amount of psychological pressures on them, and you wonder about the sort of supratentorial neural tension that goes into hamstring tightness, muscle fatigue, and then, like you said, neuromuscular control. You just wonder whether hypnosis with just general relaxation practice and the suggestion that they can put up with it and just focus on other things apart from whatever's stirring them up, and that's the reason why you need a good history, obviously, and know your players. But the hypnosis has helped, but whether that's just a general relaxation thing or I think there is something about controlling pain with those sort of efferent descending fibers from the middle of who knows where that does do something anyway.
No, I think that's a good point, and as I say, particularly in this guy, I was concerned that there's definitely more going on than just a physiological component. Yeah. Thanks, Mark.
Thanks, Phil.
Okay. Any more questions before I just?
It's all the questions at the moment.
Tie up. Okay, lovely. So look, essentially, I guess from a who gets it, it's potentially more in males, and we see a consistent association between exercise-associated muscle cramps, prolonged activity performed at vigorous intensities. I think that sort of summarises who gets it. The mechanism, as I say, open to debate. Initially thought to be related to the actual dehydration or change in iron concentrations, then thought to be due to altered interstitial and extracellular fluid volumes related to that, causing nerve compression, and subsequently now further debate relating to a neuromuscular mechanism, which essentially what they think is that you have overexcitation of the alpha motor fibers, which causes a hyperexcitability in the muscle, and that they think that basically the Golgi tendon organ's inhibitory effect is therefore not as it should be. And the reason that this is quite a nice theory is that in general, the one thing that when you look at the evidence does seem to stop people from cramping is passive stretching. And with that passive stretching, obviously you're bringing the Golgi tendon organs back into play. From the point of view of treatments that we haven't covered, there has been talk about electrical cramp induction, which I will not go into in great detail, but apparently if we induce painful skeletal muscle cramps, we may improve our performance with exercise-associated muscle cramps. Look, I don't know who does it, and I certainly haven't seen this, and it sounds quite painful. So I think that that's probably something that would be on the back burner. Kinesiotape I would have liked to have tried, but obviously we couldn't in this case. With massage, obviously we're trying to alter neural excitability and reduce, hopefully, the potential for cramping. I think that things like, magnesium and salt tablets, as long as somebody is in control of these and you know what you're taking, and then they're not taking too much, they probably don't do any harm. But essentially, I think that the common sense approach is that someone like the American College of Sports Medicine, they basically say that with fluid replacement, athletes must consume a volume of fluid that prevents more than a 2% body weight loss from perspiration. And I think that's probably sensible. Corrective exercises, I agree, are very important. And I think the key is improve biomechanics, muscular imbalances, and postural issues, and then move maybe on to plyometric activity with rapid eccentric muscle action, and then rapid shortening of the same muscle, and see if you can improve the neuromuscular function that way. Although there's not good evidence surrounding this, but again, probably because there's not big studies. Weakness of glute maximus particularly has been shown to increase the problems with hamstring muscles. So I think that's a good point that's been made. Stretching, look, stretching definitely is effective. And we know that basically when you get cramps, it tends to be the muscles that span two joints. And that if you stretch, the passive stretching probably increases tension in the Golgi tendon organ, which gives you an increased afferent reflex inhibition. So I think common sense prevails with that. Quinine we've discussed. Pickle juice, as I say, we've discussed, and my understanding is that there does not seem to be a significant difference in plasma concentration, like when they when they do it pre and 5 minutes post pickle juice with regards to electrolytes. So they do think that it's related to this inhibition of the oropharyngeal reflex and reduction in alpha motor neuron activity. The other thing that sort of is interesting, because it is something I hadn't come across before, a little bit like the hypnosis Mark talked about, is there has been some suggestion that hyperventilation strategies can be helpful. Now, the theory is that, and I guess this feeds a little bit back to the lactic acid question at the start, but the researchers hypothesized that hypoventilation with respiratory acidosis can potentially be related to muscle cramping, and that if you hyperventilate while experiencing a cramp, they think that improves things. But look, it's only 3 participants that this study talks about, so I think that's just something that I haven't read much about, and I will read more about, but I'm not convinced I'm going to hyperventilate my patients as yet. Anyway, I think that probably ties up everything that I came across in relation to trying to find what we should do with this chap. I'm happy to provide all the literature or lit reviews that I used to anybody that wants them. Probably the nicest study I found was actually an article from April the 22nd, 1939 on the mechanism of action of quinine in myotonia and myasthenia, which was not that relevant, but I did like the fact it was a paper that was nearly 100 years old. So on that note, I will ask for final questions and draw the webinar to a close. Karen, and if you'd like to just note the references, guys, as I say, they're there, but we can provide you with copies if you want. So any questions?
Don't seem to have any at this stage. No one's hand up.
Okay. Any comments or further ideas?
Just some thank yous coming through.
No, thank you for attending. I appreciate that. After work, people are tired, and I think, but I thought it was a nice thing to start a webinar series on, and hopefully we can do one every 6 months. So if people have got ideas for things they'd like to discuss, please let us know via the specific interest group, and I'm happy to take those on board and bring them to you. Okay.
Thanks, Jill.
Thank you very much. Bye-bye. Have you turned me off?